If a circuit breaker flips in your house, are you wandering around trying to change the light bulbs, hoping that the light's going to come on? No, right? Because it's not fixing the underlying problem. Yet this is the same way that many people are going about fixing underlying pain and neurological dysfunction. I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to work with over 5,000 patients. And through that time, we've seen a lot of different problems, and a lot of it comes back to the same thing, right? We see people that are trying to turn off the pain, and that's a reasonable expectation. That's something that we want to do. We obviously do not want somebody to be in pain. But they're looking at tools that are just turning off the pain. And having that happen is kind of like driving your car and having the engine light come on. And when that engine light comes on, instead of actually going and having it checked, plugging it into the computer and seeing what the code is and having the problem fixed, we're just putting a piece of duct tape over that light and we don't see the light anymore. The problem doesn't disappear when we do that, right? We might have that symptom disappear, but the problem doesn't disappear. And yet this is what we do in so many ways when we're starting to take pain medications. There's a lot of studies that are coming out that are showing that when we use NSAIDs or anti-inflammatories early on in the process, we're setting ourselves up for chronic pain. When we use pain medications early in the process, we're setting ourselves up for chronic pain. When we use some of these other methods of turning down the pain and just dampening down that signal, we set ourselves up for chronic pain. And the underlying issue is not being addressed there, right? We're not getting that function back to where we need it to be. Instead, we're just turning down that signal. We're turning down the symptom so we don't notice it anymore. And we think that we've got the problem fixed. But what chiropractic does, we are looking for that underlying functional error and we're working to reset it. So every time we make an adjustment, we're not working to get rid of pain. We are working to get that function back. We are working to flip that circuit breaker back on. And when we have proper communication between the body and the brain, we have better functionality and pain disappears because we're addressing the underlying issue, right? So it's kind of like if your alternator goes out in your car, you can constantly charge your battery, but as soon as you turn on the car and start driving, the battery's going to die because you don't have that constant charge going in there. Same thing happens in our body. When we don't have the proper signals reaching from the brain to the body or the body to the brain, we don't have muscle firing in the proper time or sequence or patterning. And all of these other things lead to breakdown of the joints. The joints are not being used in the way that they're supposed to. The muscles are not being used in the way that they're supposed to. And they start increasing the amount of inflammation that's in that area. In a joint, as soon as we lose range of motion, we lose some of that functionality. The way that we get nutrients in is we open up that joint. And as soon as we close it down, we push out the waste products. So that pumping action that happens in there is something that actually supplies the nutrients and pumps out the waste products in the joint. When we don't have proper movement of a joint, the muscles that attach to that joint start to dysfunction. They start to tighten up a little bit because they're not being stretched and contracted. So they're not being worked in the appropriate ways. They start to spasm to provide stability and different things like that. So we start using that whole complex in a different way. We're not sending signals up to the brain. A lot of the neurological signals that we are sending in there come from that joint, from the mechanoreceptors that are in there, the joint movement signals. So as we start to move that sends a signal up to the brain that we're actually doing something. And when we have all of that, malfunctional, when we have it not functioning in the ways that it is supposed to, we get increase in dysfunction, we get increase in inflammation, and sooner or later we get degeneration in there. So we've got to go back through that process. We've got to stop the degeneration. We've got to get rid of the inflammation. We've got to get proper signaling back there. That's ultimately what the adjustment does. And this is a problem that I see so frequently throughout here is, I went and I took anti-inflammatories and it got me through the first 4 to 6 months of this, and now it's just too bad and I can't take it anymore. It's continually getting worse and worse, right? This is a problem that I have for, years and years, but it only hits me every 3 months, 6 months, 9 months. The problem is always there. It's just sooner or later that inflammation gets to the point where it becomes problematic and you notice it. That check engine light comes on. And instead of addressing it the appropriate way, we're doing just enough to reset that code and get that check engine light to go off for a short period of time, but we're not fixing the underlying problem. And that is ultimately what we aim for. And we don't just do it through adjustments. We want to make sure that you are getting adjusted and have motion through there. We want to make sure that your muscles are working the way that they're supposed to. We want to make sure that you have the metabolic function that you have. If you don't have enough energy, it's going to be hard to fix anything. If you don't have enough energy, it's going to be hard to sustain anything. We want to make sure that the neurological function is working the way that it's supposed to. Because if you don't have proper signaling down, for example, if your balance is thrown off, it's going to be hard to get proper muscle firing because that balance is constantly telling you you're falling over. So you get spasms in certain areas to keep yourself upright. So we've got to have all of these systems working together. And chiropractic works phenomenally for each of them when addressed separately. The adjustment is not the answer for all of these individually. But the adjustment is a very, very big part of getting that communication to where everything can work together. It's the integrating factor in all of that. So if you have questions, by all means, reach out. As you know, I love to talk about this stuff. I could talk about it all day. And in fact, I do, right? So if you have questions, reach out to me. Otherwise, I will catch you on next week's video. I really appreciate your time and attention. I know those are your greatest resources. I don't take that for granted. And I will see you soon.